So I'm sure you're all familiar with these ultrasonographic images here. So these go from the most immature mucocele in the top left corner, through the top row, the middle row, and then the bottom row to the bottom right corner, which is the most mature expression of the mucocele we see. And these go from sort of organised gravity independent sludge occupying more than 30% of the lumen, all the way up to the classic kiwi shape that we're very familiar with. And in addition to identifying the gallbladder mucocele itself, we often try and characterise other features. So for example, do we have any concern or suspicion for rupture? Sometimes this can be surprisingly difficult to identify, and ultrasound is recognised to be poorly sensitive for the detection of gallbladder rupture, as low as identifying 50% of cases of biliary rupture in some case series. So it can be quite difficult, and the reason for this is when we've got a significant gallbladder disease, even if the gallbladder remains intact, we can have local extra gallbladder fluid that's accumulated as a sterile inflammatory process around the gallbladder. So local fluid doesn't necessarily indicate rupture. However, it does indicate very substantial biliary disease, and often would be an indication that that's a surgical biliary disease, regardless of whether there's genuinely bile peritonitis or not. These images from this paper here really are just to demonstrate how difficult it can be to identify rupture. I think we could convince ourselves there's a possibility of rupture in all 4 of these images, whereas in fact only the top 2 are ruptured. People have explored contrast-enhanced ultrasonography to evaluate to see whether this is more accurate, and certainly this is a more sensitive means of determining whether or not there's biliary rupture, but the lack of availability and expense of the contrast means this isn't classically pursued at the moment.